Hi everyone, it's Christine, physical therapist and creator of Aging with Ability. And today I'm coming on here to talk about like your medical team. So this is definitely something I get asked a lot about when people are scheduled to go see specialists and they are not sure what that specialist is actually for. They just say, "Hey, I have a doctor's appointment with someone," and then I ask further questions about who that might be. So I did create a printable and I just want to encourage you to download that because it kind of just gives you a nice quick one-page list of some pretty common medical providers that you might be seeing or might be referred to in the future. And it just gives you a little reference sheet to look back on and go, what is their specialty? Why am I maybe seeing them? And that might help you figure that out. So, the first one on the list is your primary care provider. So, that might be your medical doctor, your internal medicine provider. Maybe you see a physician assistant or a nurse practitioner, any of those people that you call your primary care provider when you're filling out your paperwork. And the one you kind of check in with at least once a year, typically. And they're the ones who are kind of monitoring your overall health and how your different diagnoses fit together. Second on the list there is cardiologist. So this is a very common specialist that sees a lot of older adults because there's high rates of hypertension, atrial fibrillation, heart failure. If you've had a heart attack before, you likely have a cardiologist. And so their specialty is heart and blood vessels. Neurologist is another common specialty. So the brain and the spinal cord. People with Parkinson's, multiple sclerosis, post-stroke would be potentially following up with one of those. A urologist is a kidney and bladder specialist. So, especially if you have like long-term catheter needs, they would maybe be the one overseeing some of that, not the day-to-day catheter changes. That's typically a nurse, even like a home health nurse, or if you live in a facility, maybe the facility nurse is changing that catheter out, or you have a trained family member or caregiver that does that for you. But a urologist is kind of the one that says, can we trial without the catheter and see how that goes, or manage medications for bladder spasms or things like that. So that's their specialty. Orthopedic specialist, that's obviously one that I'm very familiar with working with because of post-surgery fractures, joint replacements, osteoarthritis. So those are the specialists you see for that. Some of them do spinal as well, but there is kind of an overlap between like neurosurgery and orthopedic spinal surgeons. So depending on what region you live in and who does what in that area, you might see a neurosurgeon or an orthopedic if you have like a spinal surgery need. Rheumatologist is one I'm a little bit less familiar with because it's not as common of a specialty that's needed. But of course, like rheumatoid arthritis is kind of part of who they see, but they do a lot of other things with joints and muscle inflammation and infection conditions. But that's definitely not one I see people commonly referred to. Dermatologists, skin disorders, a lot of, people over time with sun exposure can end up having issues with moles or things on their skin that they need checked out. So that's their specialist. And then a geriatrician, that's not as common of one either, but they are a physician that specializes in aging and older adults. They definitely have more kind of specialty knowledge about how conditions interact in older adults. So your primary care provider, they might see, a 3-year-old in the morning, a 25-year-old in the middle of the day, and you're 70 and they see all these ages and need to know a little bit about a lot of things because of that variability in their caseload. So a geriatrician is someone that, is specializing in a certain age range, kind of like I do as a physical therapist. I don't really treat children anymore. I have in the past an outpatient, but pretty much now my youngest patient in the last 5-6 years has been probably 48 or something. So kind of just narrowing in on that scope of practice and really digging into how those conditions interact. And kind of going along with that in a way is a pharmacist because older adults are more prone to polypharmacy. And that's something I want to talk about a little bit more on the website. It's just such a big topic with how many medications older adults are typically taking because they've been just, diagnosed with multiple diseases. So Some people, you just think, oh, I'm going to the pharmacy to pick up my medication. It's just that person that gives me that little spiel about take it in the morning with or without food type of a thing, but they're actually highly trained and have a lot of knowledge about medication interactions. And so sometimes people do meet directly with the pharmacist within like their hospital system. I've seen that offered at like the VA and things like that to just go over your list in more depth than your primary care provider can at that, 15-20 minute office visit. Next one on the list is an oncologist, which is a cancer specialist. And that definitely has a major role in managing cancer. I've worked with quite a few cancer patients in the past and learning more about the side effects of cancer treatments and managing energy conservation. A lot of people, if it's lung cancer or they have metastasized cancer to the lungs, oxygen and things like that. So oncology is a very important specialist for dealing with cancer. Gastroenterologist, that's the GI tract, so your gastrointestinal system. So kind of anything with the digestive tract is what's going to happen there. Very important, a lot more hospital-based, not as much kind of on the outpatient side from what I see in my practice. Pulmonologist, respiratory specialist, they're able to do a lot of the specialized testing for like how much expiration volume you have in your lungs. So probably if you have, chronic asthma that's becoming more difficult to manage. And then of course, like COPD is one of the biggest things that I see patients go to them for management of and medications and just kind of doing those functional tests as things change over time. An endocrinologist is a specialist in like the immune system and hormones. Definitely diabetics over time, especially if it's kind of poorly controlled, might end up referred to a specialist where they can dive a little bit deeper into some of those hormones and things like that. And then I put kind of the therapy team here at the bottom. So of course, physical therapy, which is what I am. I'm a rehab professional, very goal-oriented, making a plan of care, making changes to your life, improving function. Physical therapy has a little bit more of a skew towards like balance and walking, like what your pattern of walking looks like, how we can, improve that. And then occupational therapist is another rehab professional that we work very closely with. And it's sometimes, for patients, it feels like you're doing a lot of the same things, but that's because we both care about how you're moving. Occupational therapists are more focused on your activities of daily living or quote unquote, like things that occupy your time is kind of a way I help teach my patients to remember it. So taking that shower, getting dressed, going to the bathroom, all those management issues. You might not think about how big of a deal it is to pull up your pants after you've gone to the bathroom, but when that becomes difficult because of surgery or weakness or balance issues, that plays a big role in your function. So physical therapy and occupational therapy work very closely together in most settings, hospital, outpatient, home health. And then of course, speech therapy is another portion of that. And speech is kind of misnamed. They really work with speech issues, of course, a lot of post-stroke or children. And swallow is another big thing. So they're going to be the ones who kind of help manage like thickened liquids, what kind of texture of diet the person can tolerate, especially kind of stroke related, a lot of neurological conditions. They also can do cognitive testing, which physical therapists don't do as much. Of course, cognition is important and we relate it to, how you're managing your mobility or the sequence of things you're doing. Occupational therapists can also give cognitive exams. Theirs might be based more about like, are you able to manage your own medications? Are you putting, the tasks you're doing in a day in logical order? And speech therapy can give cognitive exams too. So definitely a lot of overlap within the rehab world. It depends on, where you're at, what your diagnosis is, who's going to play a role on your team. And then respiratory therapists, not as common to see. It's not like every home health agency has one, a little bit more hospital based, at least in my region of the world. And they work on respiratory improvement. They actually know how to like manage ventilators and things like that, depending on, again, kind of region. So not very likely to meet one in ways if you don't have a pretty significant respiratory issue. Because, of course, physical therapy, occupational therapy, when we're mobilizing someone and working with them in a day-to-day basis, we're going to see those breathing control issues and be monitoring oxygen saturation and heart rate and kind of that effort that the person's putting out too. So again, the therapy world kind of overlaps. I mean, all of medical field does have some overlap because we all care about how the person is functioning and what the treatment plan is and how we can get someone better. So that is just kind of a nice little one-page summary. There's the post that goes along with it if you want to kind of refer back to that. But yeah, I just encourage you to download that and kind of keep it handy, and maybe you have a health binder or something where you can start to put some of these documents and just have something to reference that's quick and easy. Thanks for joining me.